can just wake up.
Should we start again or more?
They feel that when we sleep, we might not wake up. Or as we are walking on the road, we can just fall and die. Oh, don't touch her, she can just fall and die. It is wrong. Oh, even if I'm not employed, I can employ you. I have a school, so I employ people. And so if you don't employ me, I employ you. So
I'm married with 2 kids, 2 amazing children. So it's a proof that we sickle cell patients are human beings and we live normal lives and we can have children.
You can do whatever you want to do, be whatever you want to be, and I believe that is the biggest misconception. But the important part, like I said, is accepting it, managing it.
Sickle cell disease is a genetic disorder which results from the presence of a mutated hemoglobin S, which causes the change in the shape of the red blood cells to be S, and it leads to symptoms such as painful crisis, low levels of blood, and susceptibility to infection. Sickle cell disease causes significant morbidity and mortality amongst people of African descent. Nigeria, being the hub of sickle cell disease in sub-Saharan Africa, has 2% to 3% of her people being affected by this disease.
My name is Olayiwaju. I'm 35 years of age. I'm married to a beautiful woman and very supportive one at that. And I have 2 lovely boys. Since I was a child, I've lived with it as long as I've known myself. Right? Yeah, so managing it has been, I can't say this is a specific thing we've been doing, but it's been a lot, like from one hospital to the other, from one doctor to the other. But personally, I would say I've been managing it by just, number one, accepting it and knowing that, okay, this is who I am, this is what I have to live with, and then doing my best to actually stay alive and also stay healthy.
Ooh. According to my parents, I was diagnosed at a very tender age, let's just say 3 years old. Managing sickle cell disease has been a roller coaster for me and my family, and also friends around me. So it has not been easy, but with the help of God, I have been managing it the best way I can, and the team of doctors that I have, because way back, the management care we have as of then is not same as now. So with each passing year, revolution goes on and new management care comes up as time goes on.
Well, there are days that I just wake up and then the body is like, just sit down and relax, you know. And then there are days that I'm all up and active and I make use of the day, best of the day.
This year I had only one crisis, but in the past years, twice. At most thrice, 3 times in a year. But presently, this year is just only 1 time.
I'm on reload for women, and I'm on hydroxyurea and folic acid and paludrin. Adapting to or getting to know that you are a sickle cell warrior, it comes with a lot of lifestyle changes for you to be healthy and for you to stay strong. So as for the lifestyle choices, I for one don't like drugs. I don't like drugs. So before, I normally throw my drugs under my bed. So they will always, blessing, you drink your drugs. They always tell me, they always remind me every day to drink my drugs. But over the years, as time goes on, I decided taking my drugs since it can help me to stay strong and healthy.
I've been taking my daily routine medications, and then when it's cold weather I wear my warm clothes, and when it's hot weather I wear appropriate clothes. But eating my balanced diet, fruits and vegetable drink, staying hydrated, taking lots of water.
I take my water. When I was on flight the last time, one woman tapped me and said, "You drink too much water, hope you're fine." I said, "Yeah, I'm okay." I'm okay. So I'm just doing this so that I will just keep my system working so that it can flush out some of the toxins.
My family and my friends, I think they've been wonderful. Without them, I don't think I'll get this far, especially my parents. Their first child, unfortunately, had the disease and died. But for me, I think they've probably been really supportive. So they've really tried to make sure that I don't endure the same fate as my sister. So they've really done the best they could, even at my age. They still try as much as possible to reach out to me, talk to me, let me know that they are there for me. While my wife, she's someone that actually knows about my health very well, and she has seen and she has tried as much as possible to educate herself to make sure that she can give me the support that I need. My friends, some of them, not all of them know actually, but the ones that know, they've been wonderful, they've been good, they've been kind, and they try as much as possible to be there for me whenever I need them.
They have been so good, so nice. My family members, my siblings, they do not leave me alone. Anytime I have crisis and I call on any of them, they are there to answer me. And my husband, the best around me. So even if it is in the night, they will have crisis, just tapping that start, and they will just take me to the hospital.
Stigmatization of sickle cell disease patients in Nigeria is still a problem. There's a widespread myth that patients with sickle cell disease do not live past 20 years of life. This is largely untrue.
Yeah, I've heard it over and over again. You know, we should be careful of what we say, especially to those that are passing through one thing or the other, because it can actually change the course of their life. No way back when they say this, and I for one, I don't like coming for checkup and I don't take my drugs. Like I earlier on said, I'll throw my drugs under the bed. Should they say I will die? Let me die because of that. And over the years I've learned that that is not true, because I've seen people that grow up to 50, 60, 90, and they are living well. They have their families, they have their children, and so on. So we should be careful of what we say around people that are passing through one stuff or the other. Not only sickle cell, it can be any other disease or any other circumstances.
Even yesterday when I went to visit somebody that was sick, one topic came up about someone who just died of sickle cell disease, and they started talking about, I thought they said he's old enough because the guy is like 41. They were like, this one lived long ago. I thought that from 22 they pass the pain, they overcome the sickness. And then one said, no, I think from 22 they die, but after then they are they overcome. If they don't die at that age, they overcome the sickness. And I was there listening to them. I'm very sure they don't know that I'm a patient. So I was just listening to them. I was like, wow, we need more awareness in this country. Honestly, for them to be talking like this, it was so funny to me.
Yes, I've heard about the myth before, and it was one that was really disturbed by, because I made some lifestyle decisions based on that. People telling you, oh, you might not live beyond this certain age, or you might not get to this certain age. But fortunately for me also, I actually had the testimonies of some, just very few actually, which I believe if I had more, it would have actually encouraged me to actually do some of this, not make some of those choices. The myth, I would say, it's a lie. Though I understand that a lot of people have lost loved ones at a very young age that were sickle cell. I know a lot of people. I even have a guardian that she lost her own daughter, her own son to sickle cell, to the disease. And but for me, I believe it's not true, especially when you make some certain lifestyle choices.
In as much as sickle cell disease has its challenges, it is not a death sentence. As long as these individuals adhere to lifestyle modifications, taking their medications, and avoiding triggers such as dehydration, extreme colds, they can live and have better quality of life. And there have been proven disease-modifying treatments such as Hydroxyurea that can help improve the quality of life of individuals with sickle cell disease. There is strong evidence that it reduces the number of painful episodes, hospitalization, number of blood transfusions, and complications that result from sickle cell disease.
My experience so far has been bliss, because like I said before Hydroxyurea, I have crisis like 3 times a year, and mild ones like just around like that. But with Hydroxyurea, I'm waiting for them. They are not coming. So if it works for me and I'm looking this good, please, they should recommend it to as many people that are passing through sickle cell disease with difficulty. Please.
Before within the shortest time, it shows that we are for you and also you are for us. Yes.
My hope for the future is to actually live a long, full life where I get to see my children grow up and also see their own children, also my grandchildren. And I think that is one of the hopes I have. I also have the hope of also impacting so many lives, like people struggling with this disease, and to be there for them and mentor them through whatever it is they're going through. That is one thing I would really like to do. The medical sector, my hopes and aspiration for the medical sector is to make treatment a more holistic approach, because it's not just the pain that affects us as sickle cell patients, because the pain is one thing, but then there are a lot of other things that we deal with emotionally, most importantly, mentally. A lot of people have gone through, even myself, I've gone through depression because of this case, but there has really been no treatment on that particular area. So I believe if the treatment can be holistic, whereby we, just don't treat the pain, but treat the patient as a whole, I think that will really help us. That's just what I believe.
So I just know that with God by my side, I am to live and live a fulfilled life, and because of that, like I said earlier, I'm over 45. I even have a sister that's close to 50, a professor. I'm not scared of anything. I'm not even scared of the disease again, because so far I have my medical practitioner around me, and I take my medication, so I'm good to go.
We need to spread the word that we can pass the certain age they mentioned, through living a healthy lifestyle, taking your medication, daily medication. And then we thank God for the recent treatments that are ongoing, like the hydroxyurea therapy. I thank God for those ones that are coming now, and with it we can live longer and see our children, hopefully see our children's children.
You have to accept it wholeheartedly, as in embrace it like your pillow. Because if you don't accept that you are this, you cannot accept the treatment plan. And when you don't accept the treatment plan, voila, it can be bad for you. So you have to first accept it. You can be strong and be up and about. You do one thing or the other, make sure you take your drugs. Adherence to drugs is not a child's play. You can take drugs today and you can skip 1 week. It will not work. And when you come to the hospital, how far are you taking your drugs? You say yes, but they are not seeing it in your blood. So please, adherence to drugs is another thing that will make you to win this disease. Thank you.
Thank you.
Although sickle cell disease has its challenges, it is not a death sentence. CESTA is embarking on a project which is focused on increasing the use of hydroxyurea amongst people living with sickle cell disease, which we believe will improve the quality of life of these individuals.